So for this we primarily see three blood sugar values. One is fasting, which is ideally fasting of 8 to 12 hours. Only plain water is allowed in this. Second is postprandial, that is PP. It should ideally be 2 hours after your meal. In some parts of the world it is also taken as 1.5 hours as well, but as a norm it is 2 hours. Third is the HbA1c. It is the last 3 months average sugar value. So as it is last 3 months average sugar value, so a meal here there is not going to change the value, so it can be taken at any point of the time. Fourth is the random blood sugar, which can be taken at any point of the day. So what the criteria says, let's talk about fasting first. If it is up to 99, it is normal. If somebody has a blood sugar of 100 to 125, that falls in the pre-diabetes or the borderline sugar range. If it is 126 or more than that, then that falls under the category of diabetes. Let's talk about PP. PP till 139 it is normal. From 140 to 199 it is the pre-diabetes range, and more than 200 is categorized as diabetes. For the sake of simplicity, I have taken PP as post meal, but as per criteria this is generally after 75 grams of anhydrous glucose. Now what do the HbA1c say? If it is still 5.6 it is normal, 5.7 to 6.4 is pre-diabetes range, and if it is 6.5 or more than that, then that falls under the category of diabetes. Now the more the number of values of a particular patient in the diabetes range, the more suggestive of patient having diabetes. So out of this, one more category is there. If somebody has random blood sugar of 200 along with the osmotic symptoms which I discussed earlier, then that is also categorized as mention of HbA1c here again. Let's suppose there are two patients, one has HbA1c of 6.4, the other person has HbA1c of 6.6. So one is in the pre-diabetes range, the other is in the diabetes range. I will explain with an analogy here. Let's suppose the passing marks in an exam are 40. One student scores 39 marks and fails, the other scores 41 marks and passes, but their knowledge understanding is the same. Similarly, it is the case of HbA1c also. If it is 6.4, 6.6, the future progression of the disease remains the same, though one falls in the pre-diabetes category, the other falls in the diabetes category. Somewhere we have to draw a line to put a patient in a particular category so that particular measures can be taken. So I hope I am clear in the strata and the HbA1c as a method of diagnosis and monitoring.